Hello and welcome to yet another episode at Visual Pathology Lab. I am Dr. Nazish, your pathology teacher. Today we will discuss through the visuals a very fundamental aspect of pathology, which is cellular adaptation. Adaptations are further classified into four categories, which includes atrophy, hypertrophy, hyperplasia, and metaplasia. For metaplasia, I've already recorded another video which is present on my YouTube channel, that is Visual Pathology Lab. You can follow the link through this video, and also you can follow our Instagram page, the link of which is also provided in the video. All right, so we will discuss atrophy first. Atrophy is actually the decrease in the size of the individual cell, leading to decrease in the size of the organ. You will wonder why atrophy occurs. Atrophy occurs where there are certain supply is blocked. For example, vascular supply is blocked. For example, nervous supply is blocked. For example, oxygen and is not provided to that particular area. For example, certain nutrients which are important for growth and sustenance are not provided to that limb. In this image, you can compare the two forearms and you can see the difference in the size and even the health status of both the limbs. Now, why would atrophy occur in one of the limb and not the other? Certainly, it is not the nutritional deficiency, but yes, there could be a vascular insufficiency, any arterial block. It could be any nervous block, but it could be most probably because of the disuse atrophy, which occurs when sometimes there is a fracture and a cast is applied and a person is unable to use his limb for a longer time period. Then this kind of atrophy occurs. It is a very common sight. Coming to the other view of the same patient, when you see and compare the hands of the both two hands of the same individual, you will notice that there is normally developed thinner eminence on the left hand, but in comparison the right hand thinner eminence is atrophic or going into degeneration. Why is it happening? Because of the denervation. There must be a nerve that has been not supplied properly, and due to which this thinner eminence is distorted morphologically as well as functionally. Another example, you can compare the two limbs. This is the posterior aspect. So the left leg is well developed. The shape, you can appreciate the shape of the calf muscles, the health of the limb. But similarly, the right side, the right leg is, it is going under atrophy. The size is shrinked, and also the shape of the calf muscle is not well developed. Another example of atrophy is Alzheimer's disease. Alzheimer's disease is a brain affecting disease which causes atrophy of the brain tissue or the parenchyma. How would you pick up that this is atrophy and not normal brain? Normally, when there are sulci and gyri in the folds are uniform and there is not much space between the folds. When there is atrophy, the sulci becomes more deeper. So the gap between the two gyri becomes bigger, and this shows that there is an atrophic brain. Another important example is an example of testis. Testis and all the hormonal environment, the nutritional environment, the temperature environment was suitable for this testis. It remained, it developed, it attained a normal size. But on the other hand, this is an atrophic testis which could not develop from the abdomen to the scrotum on time, and that's why it is shrinked in size, not well developed, possibly most probably because the environment in the abdomen was not suitable for the growth of the testes. These were some of the examples of the commonly encountered atrophic lesions, and I hope that it will clear your concept and it will give you a visual aspect of how atrophy looks. See you in the next video. Happy learning.